So last month, 123 cases of dengue fever reported. That figure includes suspected, presumed, and confirmed cases. Scary statistics for many, to tell you the truth. So what do we need to know to stay safe? And more importantly, what is being done to, I don't know if we can eradicate, but lessen, reduce the number of cases, get rid of the outbreak? We've got the Honourable Minister of Health, Dr. Christopher Tufton, here with us this morning, as well as the Principal Medical Officer and National Epidemiologist, Dr. Karen Webster-Carr. Good morning to you both.
Morning.
You've been making the rounds, so it's good to see you this morning.
Same here.
Such an important topic to talk about, Doc. You've come under a lot of pressure, a lot of criticism about this. Tell us where we are now as far as dengue is concerned.
Sure.
Give us an update.
We would have announced that the month of December of the 12 months of last year, the suspected, presumed, or confirmed cases exceeded the threshold level for that month.
Which is how many?
96, and we had 123, I think it was. So what that automatically triggers is the designation of outbreak, which has to be reported internationally. And of course, it triggers a particular discussion nationally about whether or not we knew there was one, when it was coming. The truth is that we have been monitoring the situation for the better part of the year, probably last 6 months of the year, and saw the upsurge. It is not unusual because it happens every few years, 2 to 4 years, last one being in 2016. So what we have been implementing a number of measures since the period of the upsurge and the observation of the trends. We have since intensified, obviously, because the awareness is important, the field work is important, and ensuring that we not only focus on prevention, but also to the extent that persons need treatment, that we provide the treatment at the level of the health centers and the hospitals.
Yeah, well, I've heard Dr. Clive Lai saying, well, coming out in defense, saying, we could not have caught an outbreak until there was an outbreak.
Absolutely.
You have some other people saying, we saw the spike in the numbers. Did we call it too late? Did we not apprise people too early of what was going on with the upward trend? Did we give Jamaicans enough information to kind of, I mean, we did discuss it's our responsibility, our health is our responsibility ultimately, but is there more, you think, in hindsight,
well, you know,
the government could have said
one can
done?
always assess situations and determine whether or not improvements could be had. The truth is that this outbreak, and if you look at the absolute numbers over last year, 830. The last outbreak we had 2,600. This is not as severe an outbreak, meaning 2018 versus 2016, as it was. Now, there are many factors that could contribute to that. I am prepared to say part of those, that set of factors would be the extent to which we have implemented a number of measures. The hiring of 1,000 additional workers who have been out in the field, inspecting mosquito breeding sites, providing information to residents, treating water once they find these sites. We had a public education program. I am on record of saying that we are seeing a surge in the numbers. The epidemiologist, Dr. Webster-Carr, has been saying it. She has been on several programs. And this is as far back as four or 5 months ago. So to say that we could do more, you know, they say hindsight is 20/20 vision. I would never be absolute in saying there's other things we could do. But to say we did nothing and to say we did not advise the public and prepared ourselves would be totally inaccurate.
Okay.
I want to ask you, Dr. Webster-Carr, because it often comes up in terms of reporting and the way we capture statistics here in Jamaica. There are cultural issues. You know, some people are not going to the doctor unless they're heading to the morgue. So how do we make adjustments, or are there ways that we can adjust how reporting happens so that we are better able to respond?
Okay, so what we look at is a historical data which takes into account reporting practices by doctors, how persons go to the doctor, and we interpret it in that way. Because when you look at the figures, for November, the threshold is 447 persons, and then it drops to 96 in December. Wow. It shows a practice. In December, we either don't go to the doctor or we don't report when we go to the doctor. So we can interpret the figures based on historical data and interpret it to take into account all these cultural.
Okay.
So when we say there's an outbreak, there is an outbreak.
We're factoring in all the variables.
All variables.
Let's talk about those people, Delia, who are not going to the doctor, who feel they can
self-diagnose
and self-medicate. So let's talk about the things that people really need to know now as we try to get this thing under control. First of all, let's start with symptoms. If I am suspected of having dengue, what am I feeling? What is my child feeling, looking like? What am I looking for?
Okay, so symptoms are usually fever, pain at the back of the eyes, headache, muscle pain, joint pains are usually what persons would experience. And you should take only paracetamol or acetaminophen.
So Panadol, Cetamol. Right?
Yes.
We call some of them because
you can call them.
Yeah, call the regular name.
Panadol, paracetamol, cetamol, and what you should not take: aspirin, cataflam, and ibuprofen.
Okay.
So those are the things you stay away from, and that's because the more severe form of dengue causes bleeding.
Yes.
And clearly those medications will amplify that problem, and therefore you want to stay away from that, which is why we advise persons, if you have the symptoms and you're unsure, stick with the Panadol, or better yet, go to your clinic, go to your private physician and have them do a clinical diagnosis of the problem.
Is it that the regular dengue becomes, deteriorates into hemorrhage?
So you can have complications of dengue, which leads to possible bleeding. So what we need persons to recognize are the symptoms that suggest you're going into a severe dengue. So the warning signs are vomiting that persists. If you're just feeling lethargic or the child is restless, probably not eating, if they have abdominal pain that persists or tenderness, these are signs that you may be going into severe dengue. And you should get attention if that happens and insist as parents that our children get the attention.
I want to raise the vector control issue, Dr. Tufton, because right now there are things that you can do in your own home, but there are also things within communities that need to be addressed. Are our vector teams going to be rolling out in communities? If I live in a community and I have a concern, can I contact the ministry and say, listen, there's a gully near here, what happens? What do we do?
All right, so yes, the vector team actually have been engaged. We have permanent workers, and then we engage temporary workers. We had activated the engagement of temporary workers, 1,000 temporary workers from as far back as June as part of the response. And essentially what they do, as you have said, they go into communities, they visit homes, they have their identification badges, they inspect breeding sites from the drums to the tanks, to the condensed tin or the sardine tin in the back of the yard, to the used tires. They provide a brochure and they have a treatment that they apply to those sources once they see breeding. So they are very, very effective, I believe. If you need that type of inspection, there is a number that you can call, and that is is it 188-LOVE or?
One Love.
One Love. That's the number.
1-888 One Love.
Right.
Okay.
And request some inspection, because we have teams in every parish. We have identified vulnerable communities across the country, and the reality is that they spend more time in those vulnerable communities, just over 300 or so communities, which are known to, or based on what we see coming into the hospitals and the clinics. We track the origin of these individuals and identify those areas. But if they are not in your area, then you can request them to visit, and we'll do that.
You're giving us a wrap on time, but I want to ask, Doc, you said if you feel like you're heading into severe dengue, head to hospitals. Hospitals are, I understand, especially Bustamante, bursting at the seams. Are we equipped to deal with this?
Well, we have to be. So what has happened at Bustamante and other accident and emergency, we have increase the number of doctors, nurses, and administrative staff to deal with it. Because if you're that severe, that the child really looking ill, it makes sense to go straight to the hospital.
Yeah, Doc, that's been an issue for many parents as well, who said that they have children sitting down for hours waiting on patient care, can't get it. We have nurses complaining of working double shifts.
Right. Well, listen, when you have these occurrences, and remember too, the flu season coincided with the sort of surge of the dengue cases. We have not built, I keep saying that we have not built a hospital in Jamaica for the last nearly 30 years. We have an old infrastructure, and we are making do with what we have. I think the clinicians are working very hard. They make themselves available, and what we have to do is to manage the process. So yes, I am prepared to admit and accept that we do have overcrowding, particularly in these times. But what we do, we shift persons around, move from one hospital to the next. In the case of Bustamante Hospital for Children, our children are particularly vulnerable because their immune system to the dengue virus, to the environment, is not as mature.
As ours, right.
And so that is a particular institution that is affected. So we have transferred persons to UWI. We have been working with the Chess Hospital, with the St. Joseph's Hospital, and it really is a case of logistics management of the process. I want to just say one thing, because I know time in and out, as it relates to an outbreak declaration. What those who call for earlier declaration, even before the definition is met, need to appreciate is that it has international implications for the country. We have to log a declaration with the WHO. It has implications for advisories as to whether people should visit the country, for the tourism industry. Now, I'm not saying that it's not important, because Jamaicans come first and we have an obligation to our Jamaican people. But to spread panic, even while there is concern, is really not the solution. And therefore, we did what we had to do at the point when we were required to do it, but it never ever stopped the program of work that we were mounting based on the trends that we were observing from 4 or 5 months before.
Okay, and you have yourself and the opposition calling for blood to be given. If you can donate blood, folks, please.
And that's a good call, by the way.
Do so. Yes,
in fact,
I think so.
I'm prepared to say probably that's the best call that the opposition has made on this issue.
Okay.
Thank you.
Well said. Thank you very much. Thank you, ladies and gentlemen. Honorable Minister of Health, Dr. Christopher Tufton, and the Principal Medical Officer and National Epidemiologist, Dr. Karen Webster-Carr.
Yes, on the other side of the break, we find out what's been done to tackle human trafficking, and that's going to happen right after this.